Thank you, Dr. Christine Miranda, and also Cindy for the introduction and getting us to a place where we can start our discussion for today. I want to take some time to just make sure that those of you that are attending for the second part or the fourth part of our series, I should say, the second one kind of looking at the intersection of racism, discrimination, and mental health in Latinx communities, and specifically today looking at the impacts on adults and children. I just want to let you know that we do have, and you can access the first half of the presentation that I did opening the series, and I'm very thankful for the Hispanic and Latino Prevention Technology Transfer Center, the Hispanic and Latino Addiction Technology Transfer Center, and of course, my sponsoring agency, the National Hispanic and Latino Mental Health Technology Transfer Centers. You know, with them supporting this work, we're able to enter into these tough conversations that, you know, are uncomfortable and may cause people to get stressed and worried and frustrated. And, you know, I just want to start by saying that our approach to this work comes from a place of compassion and from a place of wanting to create collaboration and partnership. Although there are terms and there are real life situations that may cause divisiveness, we hope that the intent of these discussions and these presentations is to create a platform to actually engage with others cross-racially and bringing people to the table to discuss these issues that directly impact our young people. And today we're focused more on kind of the youth and families, you know, relative to the experience that they may have in the United States, and especially now that we're seeing some of the social and civil uprising relative to certain groups of people. You know, one of the terms or concepts that we introduced the first series and the first presentation that I did, part one of this, was looking at cognitive dissonance. And again, cognitive dissonance is kind of this, it really is the brain's work of trying to keep us psychologically safe, right? Where we hear information that may be counter to what we learned. And when we talk about this specific topic, we're talking about behaviors, we're talking about values that have been instilled in us since we were young children, through our upbringing, through our community experience, through our familial experience, that creates a certain awareness about races and certain groups of people. Now, part of what we want to understand is that along with cognitive dissonance, we have to understand implicit bias, right? And that's where these learned behaviors that we were brought up with may impact our decision making in today, in our practice in 2020, and in our understanding of some of the issues that we're facing racially and discriminatorily in the country. So we want to kind of get a sense from you, and you all, you know, we're not going to do this by any way of measuring or asking you guys to speak out, because, you know, I think this is a time where critical self-reflection is imperative. And you know, one of the things that we wanted to share from Dr. Andrew Ibrahim is his model here that looks at becoming anti-racist, and he looks at three different zones: the fear zone, the learning zone, and the growth zone, meaning that we have to critically assess where we are, especially when we're talking about providing services to Latino and Hispanic families, you know, where we are in terms of our willingness to be an ally with clients that may be of a different race than ours, and potentially where are we doing harm to people of a different race or culture than ours if we're not paying attention, if we're not looking at our blind spots, if we're not using you know, our ability to be compassionate to human beings and seeing people for that just as human beings, right? Which is hard for us to do, because we have learned behavior ingrained in us through our experience, not only through public education, but through school systems and other systems that we see, you know, our involvement in as we grow into adulthood. So the first zone is fear zone. It's this kind of position. So we ask you, what zone are you in? And it's okay to really be honest with yourself. Ultimately, you're the only one that's going to know the answer to this question, right? And we may present, and that's one thing I want to say, is that we may present in certain ways that are politically correct, that don't show any sort of supremacy or divisiveness or discrimination, because we know that it's politically incorrect to say certain things. But when we're in private, we may say things, or we may believe things, or we may laugh at certain people's jokes around race and racism, around xenophobia, and around issues relative to what we're seeing civilly in our communities today. With the heat of the election coming, we're seeing a lot of groups being in conflict with one another. And ultimately, that's the goal of those that are in control, is to keep us at odds with each other. So our goal is not to further that divisiveness. Our goal is not to further that disagreement, but to have a discussion in a platform where we can, as providers, as a community of people that are compassionate and care for individuals, be realistic and honest with where we are in terms of becoming anti-racist. Are we in the fear zone, where I deny racism as a problem, I avoid hard questions, or despite evidence and factual information about certain races of people experiencing violence at much greater levels than other groups of people, do I take that information and kind of shun it away, despite my training and instincts as a researcher and as a provider to engage research, right, and to validate that and to put practice into research, right, and vice versa? Do I strive to be comfortable, right? Do I push those things off and kind of deflect those situations, or ignore them in the community or in my workplace, because I don't want the conflict, or I don't want to seem as though I am one of them, right? Or somebody that is creating any waves in my organization or in my family even, or in my network. So we all have to also take inventory of what are our circles of influence that surround each one of us. And start with that. How can we take inventory and stock of those circles of influences that we have some say in, and our voice is a part of, to start to disrupt and not be complicit to racist acts and issues that create divisiveness and discrimination and discriminatory practices within mental health agencies and in communities. Do you take the more comfortable route and tend to talk to others who look and think like you do? Or do you take challenges and strive to meet folks outside of your group and try to learn them as a human being, as someone with a different culture, different race, different racial markers that have been assigned to us, right, by none of us that are in control or power, but by those powers that be, that create a difference in us? Or are you in the learning zone, which I hope that most of you are either moving from the fear zone or starting to again, when we look at stages of change, right, relative, and we can look at it relative to becoming anti-racist as well. Where am I moving, and am I in the contemplation, or am I starting to move into the action? And learning is to a degree straddling the action phase, where now I recognize racism is a present and current problem. I seek out questions that make me uncomfortable, or I look in the mirror and reflect back on myself of what am I doing to be complicit in situations that may be discriminatory or divisive or racist. I seek out questions that make me uncomfortable. Again, are we looking at ourselves from the place where we're good to be politically correct, and we can do that, but then there's things that we believe or say when we're in the privacy of our home or amongst friends that may believe similarly to the way we do? Do you, or do we all, and I understand my privilege, and I want to just kind of state that I'm very privileged to be in the position that I am, to talk to you and to be able to share with you my experiences and how I have been asked to present this information. And I'll be honest with you, I have been emotional about this. but I'm also very excited about it because for a long time we've been in positions as people of color and as the Latinx community where we have to take a lot of the fallout of decisions and policies and systems that are oppressive. And now, and I'm thankful for the MHTTC, the ATTC, and the PTTTC for those that are leaders and are courageous enough to allow us this platform to talk about it. And by no means do we want to create more divisiveness, but more collaboration is our intent. So back to the learning zone. Do you educate yourself about race and structural racism? And those of you that are on this call today, all 233 of you or 34 of you and climbing, and I hope we get more people to join in. You're here for a reason, right? And that should be the stepping stone to further educating yourself and to further understanding what race and structural racism looks like and how we can be a participating person or provider in the disruption of these practices. Do you consider yourself vulnerable about your own biases and knowledge gaps? Do you listen to others who think and look differently than you? Or do you tend to cut those people off or not give valor or not give credit or affirm that they may be right and they may be onto something or that they may be doing the right thing? Are you someone that stands up to other leadership in your agencies who may be using microaggressions behind your back or in certain meetings where you may not be present or may be involved in certain meetings, but you hear about some of the practices and discussions, and yet you do nothing to interrupt that or to confront that or to at least ask for clarity about what is going on in those situations? Or are you in the growth zone where you surround yourself with others who think and look differently than yourself? And there's nothing wrong with being comfortable and being in circles and having those friends, obviously, that look like us, have similar values, but it is something to say when we're not willing to step outside of that and engage with people of different backgrounds, ethnic, cultural, racial, etc. I yield positions of power to those otherwise marginalized, right? Do you put yourself in a position where you may be a certain voice or carry a certain amount of authority and you have the power to engage or allow others to be involved in the conversation? Are you engaging those other people? Are you engaging those that are typically othered, right, or kept outside of those groups that are more dominant in decision making? And I hope that you don't let mistakes deter you from being better, right? We all make mistakes. We all say things that are maybe bias or express ourselves in a way that we're not sure how to talk about a certain subject. It's very interesting as I've gone through doctoral studies and I got involved and we engage these discussions in a very deep and profound way and critical way, is that it was very evident to me that sometimes people just don't know how to talk about this stuff. And it's kind of one of those taboo subjects, almost like suicide in certain cultural groups. It's almost like sex in certain groups, that you just don't talk about it, and it is meant to kind of take care of itself. Well, we know that it's not taking care of itself, and it's evident by some of the information and the behaviors that we're seeing play out in the last 6 to 8 months in our countries, and more 3 to 4 years that we've seen more long term. Do you educate yourself about how racism has impacted our profession? Do you speak out when racism is active in your environment and in your agency and in your circles of influence? Are you okay sitting with your discomfort and really being able to understand how impactful, especially those of you that come from the more dominant groups in your community or in your culture and your society, that you use that power and privilege to be able to engage and promote and advocate for policies and leaders that are anti-racist? And do you become that voice as well? And then lastly, do you identify how I may unknowingly benefit from racism? I think we want to make sure again that in this presentation we're not pointing fingers at any one group, because even those of us that come from Latino and Hispanic groups can also be biased about other Latino and Hispanics. And let's just be honest about that, right? The darker your skin, or if you come from more countries of Mexican descent than other communities that may be more prominent and prevalent and dominant, there's degrees within each one of our cultures and races that may exhibit certain biases and prejudices that we have to understand and just be aware of. So as we understand that, we then have to come in to understand, how does racism now start to impact the clients that we're seeing? And I think one key piece that I want to stress in this presentation is how important it is for us to be able to validate for people of color and for the Latinx communities, young people, adolescents, and children, when they're feeling certain physiological symptoms in their body, maybe headache, maybe stomach ache or a nervous stomach, ansias. When we hear those things, let's not solely just kind of chalk them up to other mental health stuff going on, or, oh, those are normal experiences for a young person growing up. Maybe they're experiencing racism. Maybe they're experiencing being othered in their community or in their school or in their agency that they're seeking services from. We definitely know that we have to pay attention to acculturation gaps. And first generation, second generation, and third generation, there's always going to be these gaps in those immigration experiences. And even for communities that are second and third generation, that young people tend to learn at a much more rapid pace than their older counterparts, right? And than their parents or grandparents, because of social media, because of these different social websites that they go to. They're learning different discourse that may be racist, that may be othering of them, and at the same time they're learning at a much more rapid pace, so they're taking in a lot more information that may be again stressful and biased against who they are and where they come from and how they dress and how they talk and how they speak and how they look physically. Dark skin, dark hair, physical features that represent certain races that have been assigned to us by those in power. And we have to understand that there's studies show that obviously adults and Hispanic youth are especially vulnerable to the psychological stressors associated with immigration and acculturation. And we'll see what that kind of looks like here in just a little bit. We definitely have to understand and recognize the impact and importance of assessing for adverse childhood experiences, or ACEs, among Latinx youth at intake and an assessment. And that will then, I think, help us to also paint a picture for the parents or the family support that this child has or does not have in order of engaging family in this process as well. I gave a talk yesterday on the importance of doing cultural formulation interviews from a peer perspective, certified peer support worker perspective, as part of a clinical team. And I think peers have a very important role in engaging with families and understanding, especially families that come from an immigration experience, for understanding how that experience has impacted their family, mental health wise and other. And we look at these statistics, and they're staggering, right? 61%, so 1 in 6 reported they experienced 4 or more types of ACEs across 25 states. Now, this data here, let me just be clear, is not specific to those that have experienced trauma during immigration. These are ACEs in general, but you can imagine how much more greater those experiences are when they have experienced those on the immigration journey that young people are reporting to us, right? Where they see rape, they see murder, they see gangs providing different sorts of violent acts against family members and threatening family members. So we know that preventing ACEs, or at least addressing them early, can potentially reduce many health conditions. we definitely understand and know that some children are at greater risk, and we want to make sure that you understand that we're focusing and providing the specific impact to Latinx youth and children, and of course families with that. I definitely think, and that may be something we engage down the road, but looking at this impact for those experiencing immigration trauma is definitely something that has to be looked at in terms of ACEs, and I think that's a study that can definitely provide much needed data in terms of looking long-term outcomes of the impact of ACEs, and longitudinal studies that will hopefully gather that for us if we're able to engage that. And then ACEs are costly. It definitely looks at hundreds of billions of dollars each year in terms of different experiences. So some of the three basic, or I should say not basic, but more prevalent variables that show up within our work is child abuse, neglect, household challenges. So when we look at abuse, we look at physical and emotional and sexual. We definitely have to understand, and research is starting to come out that we're going to start to utilize and create other presentations from, but we're starting to see now data that is showing us how COVID has really impacted Latinx communities, especially because we see a lack of access to healthcare. We see a lack of access to mental health services. We see isolation. We see obviously lower socioeconomic or poverty issues playing a huge role in that as well. And then some of the household challenges that we see, right? Incarcerated household member. And I definitely say that if we were to specifically look at those that have immigrated here and experienced the incarceration process that the United States has implemented in I would say replacing or taking the place of immigration policy that is effective, that's considerate, that's compassionate, right? Instead of really implementing a immigration policy that is all of those things, we have young kids locked up in cages, and we have families separated from these children. And we start to then see what some of these household challenges are gonna be when we look at mother treated violently, not only from their spouse or partner, but now we're also gonna see that impacted from women, with reports and recent senators visiting some of these facilities to see if Latinx women and mothers are being treated very violently with regard to their rights as a woman. And we have to see that as something to think about when we're talking long-term impact. Mental illness, obviously an impact. And then the last one there, incarcerated household member. We see reports that people are reporting their experience within these facilities as being incarcerated, not having rights, not having access to services that they may need in terms of mental health and medical. So early adversity has lasting impacts. So these are some of the lasting impacts that we see that may have long-term trajectory, and we have to really consider. So injury, traumatic brain injury, depression and anxiety, we definitely see a high propensity of suicidality and PTSD, and those two obviously have some correlation and connectivity. Unintended pregnancy, pregnancy complications, and fetal death, HIV or STDs, cancer and diabetes, alcohol and drug abuse or unsafe sex, and then lower levels of income based on occupations and lower levels of education attained. So the adverse childhood effects and experiences can impact every single one of these, and we have to do our work in the prevention world as much as we have to do in intervention and treatment. So evidence tells us that preventing ACEs can be preventative, and we can do that by strengthening economic support for families. We can also promote social norms that protect against violence and adversity, ensuring a strong start for children and paving the way for them to reach their full potential, teaching skills to help parents, And of course, to help the youth handle stress, manage emotions, tackle everyday challenges that many of us in our adulthood didn't experience as children. And then, of course, connecting youth to caring adults. And when I say that, we're also talking about providers who are aware of racism and discrimination, and how those experiences also may lead to adverse childhood experiences, and intervening in terms of lessening the impact and the long-term effects is definitely our goal, and what we're trying to obviously achieve through our workshops and through working directly in communities. So some of the, when we talk about some of the work that's happening in school systems, obviously you all know, those of you that are coming from the teaching world and schools, and thank you so much for the work that you do as essential employees, and our doctors and nurses, we can't say enough about those folks. But our teachers who are now trying to teach through a new normal and to be at the front line of some of these experiences. I've heard some really stressful experiences that teachers have shared, where they are now starting to see, because now, with a computer and a laptop in people's homes, sometimes teachers are now seeing things in the homes that we probably would never have seen if children and young adults were in school right now. Right. And I mean, when we talk about neglect, or, not really having the child be supported at home when they're trying to learn, or, having to do lessons on their own, and other experiences of that nature. So we definitely understand that through traumatic experiences that some of the young people that are coming in and experiencing immigration through incarceration at these detention centers, that previous traumatic or stressful events may definitely be a part of what they're reporting and experiencing. Separation from caregivers obviously is huge, and how parents and caregivers respond is obviously another aspect of that. But all of these, 10 to 12 areas here, factors, influence a child's emotional response to emergencies and disasters. And the reason that we brought this and kind of shared crisis, emergencies, and disasters is because we're all experiencing things right now at different levels, right? The pandemic that people are experiencing, some natural disasters that other communities are experiencing on top of a pandemic, and then crisis that people are experiencing just in day-to-day experiences on top of emergencies and disasters and pandemics. So all of these stressors right now, we have to understand, are compounded, and each one of these factors are an integral part of helping young people emotionally respond in a healthy way to these stressors that they're experiencing. I used this graph last time, and I just wanted to bring one of the pictures from our last presentation, or the first part of this 4-part series, to remind us that the decisions today impact long-term outcomes for our young people, right? And when we use platforms that we have to continue to bring light to the fact that young brown and Hispanic and Latino young people are locked up in cages right now in our own country, in the United States, as opposed to having a thoughtful, compassionate immigration policy that's effective, we've chosen a more discriminatory and divisive approach to impacting and starting to try to change immigration. Or is the intent to send a message? Is the intent of locking up young brown children and breaking up families, is that an intentional message to families to continue to other them? Even though many of these families are seeking asylum from other violent situations, they're experiencing that violence and trauma or re-traumatization within one of the richest countries in the world, within the United States. And I bring this light to our attention again, because we have to be advocates. We have to be the voice for these young people. And when I say we, I'm not talking about we Latinos, because we're already doing that. Many brown providers and Latino and Hispanic providers and communities are already doing this, advocating, speaking up, continuing the dialogue. But we need others. We need others that don't look like us, that are in and a part of other dominant groups, to also speak up, and to also see that treating young people and families like this is a travesty. This is not the way you treat human beings. We can do better, and I think we have the power and the potential to do better. One thing that we want to understand and we want to bring back from the last presentation, there was, I think, 2 or 3 slides that I brought back that I want to continue to have as a part of today's conversation and dialogue, is that cultural concepts of distress, or CCD, are expressed through 3 concepts that we know. So when we start to look at these, we want to make sure, especially for those of you providers that are using, which we really highly recommend the use of the cultural formulation interview that's a part of the DSM-5, and really utilize that as a mechanism to even adapt and add a scoring portion or a area of that instrument where you include some ACEs and some questions on ACEs. And there's plenty of ACEs screening instruments that are out there already if you want to look for those and adapt those. But we want you to look at the cultural concepts of distress through kind of 3 specific concepts. One is cultural syndromes. So groups of symptoms that occur among individuals in specific cultural groups, communities, and contexts. Which we are definitely going to see, and we see that already with past folks that have immigrated to this country, and we've also now started to see that with families who are immigrating here and have the experience of being incarcerated and separated from families. And they may now carry on cultural syndromes of similar traumatic experiences, very similar to how I would say the work of Yellow Horse and her work relative to post-traumatic stress, right? And I think that's Maria Yellow Horse is definitely work that looks at these kind of clustering of cultural bound syndromes that are connected to post-traumatic stress relative to a historical trauma experience. And I think that work lends itself potentially to some of this as well. And then we also look at cultural idioms of distress. So ways that symptoms are expressed through a collective, shared ways of experiencing and talking about personal and social experiences. And then cultural explanations, perceived causes, so labels, attributions, or features of the explanatory model that indicate culturally recognized meaning or etiology for symptoms, illness, or distress. And those are the idioms of distress that we talked about, and really specifically looked at what those may kind of be in terms of mental health disorders. We looked at ataque de nervios, and we looked at susto. And we see those 2 as very prominent in terms of traumatic experiences and what people may be reporting or coming to providers reporting that they are experiencing, which may be characterized by physiological symptoms rather than psychosomatic, or rather than, I should say, presenting as typical mental health symptoms, I should say, rather than looking at it from kind of the experience. And really, I think it's unique, right? We have to think about that, is each client that we see that has experienced immigration is different from one to the next. Some may have experienced immigration and not have experienced any violence or separation from family, and others we see are replete with those experiences. So it's taking every situation case by case and assessing it, and not slapping kind of a blanket diagnosis on it, is what I want to clarify there. So some of the recommended activities and for a responsive individual and community-based initiatives, and this is looking and also some recommendations that are for unaccompanied minors, or if you're experiencing in your agency, or if you haven't yet, this is something that we want to kind of see and get ahead of the curve on, is if you're not seeing these individuals start to show up within your school systems or your agencies where you're providing mental health and other services, we think that that is definitely going to start to happen, especially in more immigrant-friendly communities around the country, and cities and towns, where you definitely have to start to look at what are we going to do in terms of a community-based response and initiative that is going to address populations of unaccompanied minors in schools. And from individual kind of professionals or taking kind of that view, we want to offer supportive clinical and prevention programming that is based in communities, in school, after school, and maybe available in shelters as well. Sometimes we don't think about it, but we definitely have to think about where will unaccompanied minors and or families who are living, maybe experiencing homelessness or not having a place to shelter at the moment because of their immigration experience, where are those people going and congregating in your communities? And those may be, it may not be in schools, but it may be in shelters, it may be in other community agencies that are friendly and receptive and safe places for folks. So as providers, we have to sometimes go outside of our comfort zone and offer services in those areas as well. We definitely have to apply best practice standards. And we're hopeful that some of the information we're providing to you all today can serve as some of those best practices and standards. But also we look at the class standards, cultural and linguistic standards that are national standards available to us to help guide our practice. Those are extremely important, and I ask you to, if you don't have a copy of those and you serve Hispanic and Latino families, and other families that speak other languages other than English, and all families and people of different races and ethnicities need cultural competent services. We're not just talking about the Latino and Hispanic families, but all families that we serve, deserve that. We definitely need to seek continued professional education in conducting immigration-related forensic evaluations. We definitely need to provide accessible, expert, and ethical mental health evaluations as part of asylum cases and other immigration relief petitions. So being in a position where you can serve clients, and if not, and you can't serve these needs, that you are able to refer them to other services that can better serve them. Professional organizations can definitely offer continuing ed credits for in-person and online trainings for mental health providers, especially with a focus on specific ethnic or racial populations, and those, again, working with unaccompanied children, promote educational opportunities for other professionals who interact with unaccompanied children. So we definitely want to see, and we're hopeful that some of our training start to impact. And we've recently been asked to give a presentation to the Texas juvenile justice system, and we're excited about that, because we have to engage lawyers, educators, government officials, policymakers, law enforcement as part of this training and awareness around culturally appropriate and sensitive practices, anti-racist approaches to interactions with people of color. We definitely have to provide funding opportunities. If you're an organization that may be able to provide those funding opportunities, make sure that there's research and community-based education for those needs and the services that you're seeing that are needed in agencies and communities for unaccompanied children. And then create definitely a repository of relevant research. We shared with the group last time, that those of you that attended our first part of this series, actually a reference page from my dissertation that is just I think a primer for looking at some of these more institutional approaches to analyzing racist structures and really seeing where we can do better and where we can as agencies create a culture and a psychological kind of movement around healing and around openness and transparency, and at the same time, again, addressing discriminatory practices, biases, and racism directly. Develop interest groups for professionals and students seeking to expand their competencies or around these populations that we're seeing. And then community organizations can ensure that organizational policies and procedures promote, again, the application of best practices across services. And that includes, like I mentioned earlier, including some ACEs content and questions around screenings. Do a really thorough job of triaging that's culturally sensitive, because that's what we know is a direct impact to and we could put this under structural racism, right, where we look at the mechanisms, and accessibility and language accessibility are two of those that we see are definitely reasons why people of color and Latinx community members typically don't seek out services, because the services are not created for them and are not culturally and racially and ethically appropriate for them. Establish multidisciplinary, trauma-informed, and victim-centered partnerships. If you don't have that expertise, seek outside of your network. And if you have the possibility of contracting with these professionals, or I definitely encourage you to reach out to us at the MHTTC and the other TTCs. Is there are a ton of and I'm very honored to be a part of those. There's a ton of folks that are just passionate and compassionate and really are experts in their fields and want to do better and want to help. So reach out to us and we can put you in touch with other experts who may better serve your needs if we're not able to directly. I think it's important for us to look at how do we connect with other countries and have the dialogue, not just across our country, but across the nations where people are struggling, and immigration and all these racial tensions that are a part of the U.S. Kind of way of functioning right now, and historically have always been, let's be realistic, are really making people of color really very uncomfortable from my conversations. And we as practitioners, providers, and people who are compassionate and embrace other cultures and races, we have to be conduits for that peace and that love, and really try to promote unity rather than division. If we're looking, again, federal, state, and federal agencies, we definitely should start to require that detention facility, shelters, and subcontract organizations implement best practice standards for evaluation and treatment of those unaccompanied children. We have to infuse and promote the use of and utilize available data to advocate for the least restrictive environments. Especially with the information that we know around ACEs and around trauma, right? We have to inform and we have to advocate and we have to speak up. We have to allocate funding to expand access to services for unaccompanied children. And of course, as we start to get these folks and these young people placed back with families, hopefully with their families reunited and or, in other adoptive type of situations, start to really expand that and make those services available. So we are in summary, and I have a little bit of time. I have about 10 minutes or so, maybe a little bit less. But I just want to share one more piece of information that I think is important for us to understand, is that there's a lot of terms out there that continue to be thrown around. There's, even in 2020, if you can imagine, still censorship happening, right, relative to what we can engage in conversation in some of our trainings and what we can't engage in conversation and in dialogue in some of our trainings, regardless if our attempt is to collaborate, is to partner, is to remove divisive language and to remove these structures that have typically created a separation between us. Despite that, in our efforts, in our commitment to that, we're still asked to not use words that make certain groups of people feel uncomfortable, or that create certain thoughts or notions that our government and our society is not created equally. Which, to me, that continues with the whole idea of cognitive dissonance, right? To me, it reaffirms and re-strengthens that whole position of, let's push information, let's push all this research and data that's showing us how people of color and those from the Latinx communities are experiencing systems of oppression and systems of institutional racism on a first-hand basis and experiencing them violently. When we continue to be told not to talk about those things, despite our efforts to be compassionate, as I've said, we have to continue to dialogue and know that there are certain practices that are kind of held under this power of white supremacy and domination, and that are totally unacceptable, right? When we talk about KKK and white nationalists, and when we talk about all of these practices that are extremely racist and have a history of racism connected to them, yet there's practices that are still going on that could still fall under that auspice of supremacy that we still think are allowable, and those are and include, especially when we look at Michelle Alexander's work of the new Jim Crow. And I strongly encourage all of you that haven't read that book to get it and read it and look at the data and the study and research that she's put into that work. When we see the school to prison pipeline still alive and strong, when we see minorities and people of color, especially brown and black people, being sentenced to longer sentences for similar crimes relative to drug and substance use as their counterparts from dominant groups, being charged at much higher levels, longer sentences. When we continue to see our leaders be proud of asking for redlining in our communities and for separation of the wealthy and people, house moms and folks that want to present as though they're being kept safe in their gated communities and in those sort of neighborhoods, right? When that's promoted through our power and government and through entities that have that decision-making power, it's very hard for us to say and to find ways to be understanding of those practices, right? It's very hard for us not to call out those practices as racist and as very much promoting an us against them kind of dichotomy, right? It's very easy for us when we see those things to become frustrated and to become bitter and angry. And I ask you, because I really want to bring this back up, because I didn't talk about it last time. But when you're experiencing cognitive dissonance, and then I'll get back to my last summary slide here. When we talk about cognitive dissonance, and if you're in kind of one of those first couple of experiences, right, where you're just learning, maybe still pushing back on evidence and pushing back on real life experiences that people describe as racist and as discriminatory, if you're still in those places, we ask you to try this on. We ask you to give it an opportunity and to try to learn, and maybe to talk less and listen more to people of color. We ask those of you that are in positions, and those of you people of color and from the Latinx community that have been doing this work for years and have been advocating for non-discriminatory practices, for access to healthcare, access to just care in our language and in Spanish and in multiple languages, right? Those of you that have been doing this work for all that time, we ask you to continue to stay strong and to continue to have hope. Because I am very hopeful that not only the generation of myself and professionals from my generation, but those that are coming up behind us and the younger generation will start to step up into their position, because we all have social justice work to do to eradicate racism and discrimination. Creating a safe space for these discussions will increase or decrease, I'm sorry, the us against them mentality. Let me say that again. Creating safe spaces for these discussions will decrease the us against them mentality, which is a legacy of colonization that we have to stop. We have to stop falling for these practices and these policies that separate us as a people. Critical self-reflection, although difficult, is required, in bold capital letters, right, is required. If we want to truly create equity and recognize our own implicit and learned biases, and we have to lastly, we can't end the conversation here, right? The conversation cannot end here. And I'm very thankful again to the ATTCs, the MHTTCs, and the PTTCCs for their commitment to this work and for allowing me to share some of my knowledge and some of my research and some of the work that I've been doing you know, for a while now with you all, and for giving us a platform to do so. You know, many of my colleagues may not be in the same situation as me, and you're with me in my thoughts and with me in how I present the material, because believe me, folks, there's many other people that are doing this sort of critical work and really looking at systems of oppression and institutional racism and how we can better collaborate across the board, right? People of color with whites, with dominant groups, with however they label us, right? With other human beings, let's just say. There's others that are willing to do that work with you and as partners in the work. And I want to reiterate and end with, we come to you by presenting this work, by reaching out and extending an olive branch and creating compassion and creating collaboration and creating more awareness of how we as a people and as providers and as allies can help address discrimination and racism head on. Again, I thank you for your time. I'll go ahead and turn it over to Cindy. And again, thank you, Christine Miranda, for introducing me, and to the MHTTC folks, Ives Carrion, our project manager, Angel Casillas, and of course, Miguel, our associate director. I can't forget Miguel. Thank you all so much. And with that, I'll turn it over to Cindy.
Thank you, Rocky, for a great presentation. We don't seem to have questions. I don't know if people want to submit a question or two before we go, but we do have a comment. And it reads like this. Not a question, but just wanted to say that this has been amazing. As a white person working in public health, I really appreciate his straightforward calling out the inequities in this country. So I just wanted to read that to you. Sorry.
Yeah, no, that's good. Thank you so much. I appreciate that comment. And you know, I know sometimes this content and the material can get people emotional. Like you saw me emotional as I presented this content. Don't let it get you to a place where you stay stagnant and you don't move, right? Get through that emotion. It's very similar to a grief process, right? That Kubler-Ross talks about. The grief of losing our racist beliefs and behaviors can be an emotional experience, believe it or not. So let's get to work. We're here to partner with you, and thank you again for the comment.
Thanks, Rocky.
And I'm sharing my email address, of course, Cindy, sorry about that. Just in case people have questions they want to email me directly, please don't hesitate to do so.
Oh yeah, I was gonna say someone was already asking for it. Okay, so we do have a question here. It says, how do we keep hope and strength in fighting back when all the systems are against us? And between parentheses, it says brown providers and our clients. I continue advocating and pushing limits so that my non-for-profit adapts to non-racist practices, but it's exhausting as it feels that I have to make upper management, I guess, No, it doesn't have like a verb there, that we matter in a sense.
Yeah, sure. I want to say one is self-care. I think that's an integral part, and I don't think that I would have kind of stayed committed to continuing to talk about this work and continue to push it. And now we're kind of finally seeing some fruits of that work by us having these platforms to talk about it more. So don't give up. I encourage you to arm yourself with knowledge and data and statistics. And now is a very ripe time to strike, because we have an opportunity, because it's so much a part of our social discourse right now, that people are feeling pressured. And when I say people, people of dominant groups who are feeling the pressure, not only from their clients but from other mid management and others. So it's a great time now to start to promote inclusion and promote equal treatment, but don't lose hope. I think that's the other third part of this. Don't lose hope in it, right? You have to find those allies and partner with people that share similar values with you, and share a similar passion and willingness to put themselves out there. And that means sometimes reaching and advocating and asking for support from people who maybe, have a little bit more power in their circles of influence, and bringing them to be a part of your team, and asking for their help. So a big part of this is collaboration as well. And I think I'll leave it with those three pieces of advice.
Thank you, Rocky. We keep getting comments on what an amazing presentation it was, like from these different perspectives. I want to thank everybody who's been submitting that. And some people are asking about certificates. Make sure you're on the lookout for the email that you're going to receive after the webinar. You're going to have instruction there for that. In that sense, I don't think we have any more questions. Rocky, I don't know if you want to say something before we go.
Yeah, I'd just like to say again, thank you all for taking some time and giving us an hour or hour and 15 minutes of your time today. This is just scratching the surface, and I hope you know that an hour and 15 minutes, I could probably do a whole week of talks, from 8 o'clock in the morning to 5 o'clock in the afternoon on race and racism, and us looking at some of this work. So just know that this is just scratching the surface, and I hope that we continue to build upon this. Our work should always be, when we're trying to look at anti-racist work, I believe our work should always come from a place of love and compassion. And I truly believe that that will prevail if we're consistent and we get others to believe in that as well. We can address racism head on, and become, providers in a country that is better off together than separated. So with that, thank you all again, and I look to talk with you all, soon in the future. Peace out there.
Thank you, Rocky, and I hope everybody has a great day. Thank you, everybody.
Bye-bye.